I am Dr. B.S.Arora. I am a psychiatrist. Today we will discuss about Cyberchondria, its signs, its symptom, and what is the treatment for Cyberchondria. Cyberchondria is a disorder in which a person searches excessively for healthcare information online rather than finding relief for their concern, diagnoses themselves with terrible disease, and then they feel more anxious. The distress caused by the preoccupation is intense enough to cause time loss from the work or a social obligation. The disorder is similar to what used to be called hyperchondria. In cyberchondria, there is a preoccupation with having an illness and persistent concern about one's health. Medical exams by health professionals and diagnostic tests do not provide adequate assurance of good health. It is not uncommon to have an underlying mental health problem, such as generalized anxiety disorder or depression. What are the signs of cyberchondria? The key feature of cyberchondria is that the person worries about having a serious illness in spite of having minimal or no symptoms. The people with cyberchondria exhibits 5 characteristic traits: a compulsive and unwanted searching for information, distress caused by searching behavior including worry and panic, excessive time used to search online, seeking reassurances from qualified person or a source, mistrust of medical professionals whose advice could be obtained in person. Typical signs that you might experiencing cyberchondria include: your actual symptoms are minor or even absent. You spend several hours per day searching online for the information about minor health related symptoms that you are experiencing. You are fearful of having at least one serious illness or possibly several serious illnesses. Searching online causes you fear and anxiety instead of relief. You experiences an increase in heart rate, sweating, or both, or anxiety related symptoms while searching online. You jump to the worst conclusion about your health condition. You may have minor, harmless health condition which has been diagnosed, such as benign cyst, but you worry excessively about the condition. You assume that what you find online is accurate and truthful. And what are the causes and the triggers for cyberchondria? There are various causes and triggers for cyberchondria ranging from single traumatic event to chronic unmanaged stress. It is estimated that in US up to 9% of the population had some degree of anxiety related to physical symptoms, and as many as 20% have anxiety about the health regardless of any symptoms. Common causes and the triggers of cyberchondria, which includes being prone to worrying in general. Roughly 70% of those with cyberchondria also having generalized anxiety disorder. Post-trauma or a tragedy, whether it is a chronic or an acute one, and the chronic unmanaged stress. Having a close relative with cyberchondria or illnesses, anxiety disorder. Heightened awareness of the body sensation. Personal or a family history of serious illness. Negative experience with a medical professional which is due to the lack of trust or confidence in physicians, or any other major life stressor, history of having severe or a serious illness, even if recovered from that illness, needing more attention from the family or the friends. How to cope up with cyberchondria? There are 6 strategies for coping cyberchondria. Coping with cyberchondria requires some self-compassion and a willingness to respond in a new way to health anxiety. Professional help is available for those with persistent or frequent symptoms or excessive anxiety. In condition to considering professional help, there are number of coping skills that are helpful in getting through an episode of cyberchondria. Here are the 6 coping strategies that work well for those with cyberchondria. Avoid self-shaming. Many individuals with cyberchondria feels embarrassed or ashamed about their tendency to believe that they have serious illnesses. This embarrassment can worsen the anxiety and even exacerbate the physical stress-related symptoms. And be compassionate to your health-related fears come from anxiety that may be deep-seated or having a long term. Such fears can be difficult to understand, but they are valid feelings, and practice some or other relaxation skills. Effective relaxation skills can be self-taught. These include deep breathing exercise, guided imagery, and muscle tension relaxation exercises or method. Challenge your thoughts about being ill. Write down your concern and then write down the evidences against this concern. Talk to your physician, talk to your doctor about your concern and anxiety and your experience. Get medical opinion. If your concern persists, rather than jump to the conclusion about the worst case scenario, see the bigger picture. Realize that there is a lot of misleading information online. Some of it is actually presented in a way to grab your attention and increase your fear and anxiety. When and how to get professional help. Cyberchondria can be diagnosed and treated by various healthcare professionals, including psychologists, psychiatrists, and social worker. The person should start with their primary care physician in order to rule out underlying physical causes. There may be a referral to a medical specialist if the physician notes any significant symptoms. It is possible to have cyberchondria as well as a legitimate medical condition. This could occur when the person's anxiety about the medical condition is out of proportion to the seriousness of the illnesses. After addressing any presenting symptom, the primary care physician will likely refer the person to a mental health care specialist. That provider will make a recommendation about the form of the therapy that will be helpful. How to get help? When a loved one suffers from cyberchondria, it may be helpful to provide proper information which reduces their embarrassment about their health anxiety. Many people with cyberchondria feel shame or embarrassment, which only worsen their level of anxiety. You might also help to encourage them to get help from mental health provider and offers you assistance in doing that. Here I am giving some tips for getting a help for the loved one with cyberchondria. Encourage them to speak to their primary care physician about their symptoms. Encourage them to help from mental health professional for their anxiety. Offer them assistance in finding a qualified therapist to work with them. Offer to remind them of appointments with the therapist. Acknowledge that searching for some medical information online is normal behavior. The Pew data shows that 61% of the population has done some searching online. However, for some of those individuals, the level of anxiety is excessive and that could be better managed. acknowledge that excessively searching online makes anxiety worsen and can be managed with the proper help. The common co-occurring disorder with cyberchondria. The treatment of cyberchondria is complicated by the fact that about 2/3 of the people with this type of disorder are likely to have at least one or other psychological disorder. Common comorbid condition or coexisting disorder that occur alongside with cyberchondria include somatic symptoms disorder, obsessive compulsive disorder known as OCD, generalized anxiety disorder known as GAD, post-traumatic stress disorder known as PTSD, and psychosis. Certain personality disorder like borderline and histrionic personality disorder can coexist. Therapy option for cyberchondria and underlying condition. Research has been done to determine the effectiveness of psychotherapy for the symptom identified as health anxiety. The following are some types of therapy which have been identified as effective treatment for health anxiety. Mindful based cognitive therapy known as MBCT. Mindful based cognitive therapy has been demonstrated to be useful addition to usual services for the patient with health anxiety. Patient who participated in MBCT in addition to usual services showed significantly lower health anxiety than those who has received as usual services. This improvement was appeared immediately after the treatment, also at a 1-year follow-up assessment. Rational emotive behavior therapy. Rational emotive behavior therapy has also shown to be helpful in learning to respond appropriately to harmless or ambiguous signal from one's own body. Client learn distraction techniques to help them to refer on your thoughts unrelated to health anxiety or symptoms. They also learn relaxation techniques to manage the anxiety and its physical manifestations. And medication. The most important question. Medication like SSRIs, known as selective serotonin reuptake inhibitors, have been helpful in managing the obsessive thoughts involved in cyberchondria and illnesses, anxiety disorder. The basis for this treatment is the similarity between cyberchondria, illness anxiety disorder, and OCD. The same medication which are helpful in treating OCD may be helpful in reducing obsessive and the compulsive aspect of cyberchondria. If you need any help, let us know. You can contact us on your mobile. you can email us. You can visit our website, that is www.psychiatrists.co.in. डॉक्टर अरोरा का नंबर है आपके पास. थैंक्स फॉर लिसनिंग.